Are you like me, frequently seeing patients coming to you in unbelievable stress? Sometimes they can't make a decision, they can't talk, they can't think, they're not listening to a word you say because they're full of fear and anxiety. So what I say to my patients is I acknowledge the fact that they're fearful, that they have anxiety. I say, I can see that you're under a lot of stress and you have a lot of anxiety. And then I say, I can completely relate to that because I have been a patient myself. And they look at me and they go, no. And I show my teeth. Now see, I have 23 teeth that are crowned. I've lost 9 teeth. Now, all of you may not be able to do that because I'm an unusual dentist that has a full mouth rehabilitation and lost my teeth when I was young. But not many people have gone through that. But you have gone through things, other things that have been scary for you, and you can share that with them. And that's the importance of being able to tell a story to a patient. So we get away from the problem that they have, and now we're in the emotional connectivity piece. I'm connecting with the patient emotionally about a problem I have. And guess what? They think I now understand them because I have had a full mouth rehabilitation. And then I say to them, not only do I understand you, but I know something. You are in the right place. Now, when you give a declarative sentence to anybody, it doesn't matter who they are, they're going to believe you. The brain tends to believe declarative sentences. When you say to somebody, wow, you're a good athlete, they go, oh, I must be a good athlete. When you declare something, the body is attracted to that. The mind is attracted to that. So I'd say to the patient, you're in the right spot. Now, what does that mean? They don't know what it means. It just makes them feel more comfortable. And then I stop for a second and I let them acknowledge that. And then I explain to them what their problem is, knowing that I've treated many people with the same problem. Because most people who come in to see us in our practices think they have the worst problem we've ever seen. And sometimes doctors make that worse by saying, oh God, I look at this. And they call, could you come in and look at this? You don't want to do that. You go, I've seen this before. Even if you haven't seen it before, say, I've seen this before. You want to minimize how dramatic the problem is. Now, I read an interesting article. I don't know if it's true, but it's an interesting article I read about dreaming. And in the United States, the most common dream or nightmare that people have is losing their teeth. In the United States and Canada, most people think about losing their teeth. If you go to other countries, let's say China or Russia, they may dream about animals or other things, like snakes are very popular in China. And parts of Africa, all different types of animals. Certain parts of the world, they may think about sex or a little bit more. But not in the United States, we're thinking about losing our teeth. So I also say to patients, I said, I bet you have a frequent dream that you're going to lose all your teeth. And then they look at me like I'm brilliant. They go, how'd you know that? I go, it's a very common dream in the United States. And they look at me, they don't believe that it's a common dream, but it is. And how do I know this? Well, besides reading it recently, I've known this for about 25, 30 years because most of my patients dream about losing their teeth. So it's very common if you're scared about losing your teeth. I don't have that dream, even though I've lost 9 teeth and I have 23 crowns, because I have a very good dentist. I have 2 very good dentists, Steve Rothenberg, who's retired, and now Dr. Min Yoon, who's still practicing. He's here in Fairfield. And they take care of me, and they make me feel safe when I'm in their practices. Otherwise, I wouldn't have gone through the treatment. So once we acknowledge that, we'll go back to patients acknowledge it. I acknowledge the fact that they're in fear, and then I tell them that they're in the right spot. Then I do something that I think is very, very important. I put them in control of their future. I put them in control of their destiny. And I do that by educating them. And I just explain to them, I am just a dentist. I happen to know a lot about teeth and gingiva and bone and gum tissue, but all I am is just a human being with a special skill, just like a plumber is a human being with a special skill. And when you need somebody with a special skill, that person's very special to you, but they're not God. They're not some sort of deity. They're not a genius. I just learned this in school. And I explain to my patients what I know, and I bring them up to a level. They're not at my level because I've gone to school for decades, but they're not at my level, but they are at my level where they can make a decision at what's best for them, and I'll give them the options. And once I educate my patient what the options are, they have the power. They have the power to make a decision for themselves. And I don't put any pressure on them. I give them the information that they need so they can make the best decision for themselves in their future. And guess what we do? We rewrite their future for them. We write a future that's very positive, not one full of fear, but a very positive future. Ben Hardy talks about this in his book, Creating an Ideal Future, that he wrote with Dan Sullivan. We create a future that they can live into that's very positive. And it's very hard for them to believe that because for years they thought they weren't worthy of having teeth. Many of our patients don't think they're worthy of having a nice smile, having an attractive smile, being able to function. And I'm sensitive to that because I know how they think. And I hope that you're sensitive to that too. Because if I take that time, that moment with that patient to communicate, it's unbelievable. So there used to be a clothing store. It was called Sims. And the person that owned it was Cy Sims. And what he did was name brand, clothing for less, discount clothing. So he would have Boss clothing or Ralph Lauren, and he would, charge maybe 20%, 30% of what they would charge for. And you'd have to go into this big warehouse, and you'd have to go through the racks to look at it. Often, Nordstrom Rack does that today. But back then, Cy Sims was a very big clothing store in the northeastern part of the United States. And his tagline was this: an educated consumer is our best customer. And I feel the same way. An educated patient is my best patient because that patient can make the best decisions for themselves. And guess what they do? They usually create a future that's positive with a lot of ideal dentistry that they want to do. And I don't have to talk them into it. Once I educate them, they'll do the right thing. And sometimes they don't want to do the right thing, or they'll let things fail. I had a patient recently, a patient that had the wherewithal to go through a full mouth rehabilitation. And he said to me, he goes, Mike, I've gone through so much this year, I just want to wait till my teeth fall out, then put me to sleep and give me a full mouth rehabilitation. And I said to him, that's what you want, isn't it? He goes, I know what you're telling me and what I need to do because I just don't want to do it. I said, then you don't have to because it's your decision. And this guy breathed a sigh of relief. He goes, I'll come back in 2 years. Whether he does or doesn't, I don't know. He may be back in 6 months. He may be back in 2 years. He may never be back, but it's his decision. And that's what I want my patients to know. It's their decision. Because when you have control over your future, then your anxiety drops and you feel more comfortable. And then I can be the gift to my patients. Hope that was helpful. Have a great day, everybody. And remember, be the gift.